Hello, everyone. My thanks to the organizers for this opportunity to share a little bit about the power of vaccines, pneumonia-fighting vaccines. So we all know what pneumonia is. It's an infection of the lungs, typically caused by viruses, bacteria, and fungal infections. So on this slide, I give you a tile of some of the pathogens that are responsible for pneumonia, some of the common and less common pathogens that are responsible for pneumonia. What you see here is that the viral pneumonias as well as the bacterial pneumonias are the commonest. And as Dr. McCulloch said earlier on, pneumonia affects largely individuals in the extremes of life, but we can't also forget that even among non-immunocompromised healthy adults, pneumonia can be a threat as well. In the US, for example, half of the deaths from bacterial pneumonia and pneumococcal pneumonia occur in people ages 18 to 64. So that really brings home the life cost perspective of pneumonia. I think this slide had been shown before. What we really want to illustrate here is that there is such variability in the burden of pneumonia across the globe, where the concentration of the risk and the burden is really in sub-Saharan Africa and in the global south, so to speak. We want to really remember the children that die from pneumonia, right? Every 39 seconds, five children die from pneumonia. And in 2019, WHO estimated that more than 700,000 children were killed by pneumonia. So it remains a silent killer or an important killer of children. As you can see from this slide, where in recent analysis by the Child Health Task Force, we show the causes of child mortality across 50-something countries that are not making as much progress in child health. You look at the bar graphs, and you can see that pneumonia, which is acute respiratory infections, which is colored in green at the bottom, represents a larger share of the deaths of children, followed by diarrhea and malaria. So even though we have interventions against pneumonia, it continues to remain an important cause of death in children. Lee mentioned that we have to look beyond the childhood, age group and start talking about the life course. So across the life course, pneumonia is a threat to health. What this slide shows from the healthdata.org from University of Washington is that the good news, which is that over time, pneumonia deaths incidence has been declining over time in all age groups, but the pace of decline is not as fast as we want it to be. So the WHO and UNICEF have put out the Integrated Global Action for Pneumonia and Diarrhea, which we are all aware of. And of the three-pronged approach that they have put out for control of pneumonia and diarrhea, vaccines are one of the critical pillars to address pneumonia. What this slide tries to show, and it's from the IVAC's Pneumonia and Diarrhea Progress Report, which is a report that IVAC releases every year that tracks our progress on these two diseases. What this report shows really is that the vaccine pillar target, which is 90% coverage for each of the following vaccines: pertussis, measles, Hib, pneumococcal conjugate vaccines, is the target. That's the Northern Star. But how are we doing with regards to that? Besides the 4 vaccines that I mentioned, I think the good news within the pneumonia space is that there are additional vaccines for that address pneumonia. So we know that COVID-19 causes pneumonia. So the The pathogens on the top, you can see, have approved vaccines. And then the pathogens at the bottom do not have approved vaccines. Just to highlight that RSV, which is a very common cause of childhood pneumonia, has a vaccine in the pipeline, not yet approved, but will be so quite will be approved quite in the near future. Now, we know that pneumonia is an important aspect of the prevention vaccines are an important aspect of the prevention of pneumonia. I want to spotlight the pneumococcal conjugate vaccine, which is one of the most impactful pneumonia vaccines that we have. We see that recent analysis that looked at the pneumococcal conjugate vaccine use across the world reported quite impressive use of the vaccine. More than 175 million cases of pneumococcal disease and more than 625,000 deaths from pneumococcal disease prevented by PCV. In South Africa, so coming down to sub-Saharan Africa, where we see that the burden of pneumonia is much higher. In South Africa, the use of PCV has led to between 23 to 33% in reduction of pneumonia in children younger than 19 years of age. South Africa has a very strong surveillance system, and so they're able to provide strong evidence of the of the use of pneumonia vaccines in the real world. And within that same study, we see that more than 18,000 deaths have been prevented between 2009 and 2016. Beyond the health impact of PCV, we have strong evidence about the economic impact of PCV. In the US, for example, the cost averted from using PCV translated to $112 per life saved. And this is quite an impressive amount. And several studies have done cost-effective analysis that show that PCV vaccine is cost-effective, cost saving. So you have the health benefits, you have the economic benefits. There are also health systems benefit of PCV and other pneumonia-fighting vaccines. For example, this analysis here looked at the immunization programs that deliver DPT, and of course, in the same process, they deliver the PCV vaccine. And they recognize that the delivery of these vaccines provides an opportunity to deliver a large range of other childhood developmental interventions, such as newborn hearing screening, sickle cell screening, treatment and surveillance, maternal education around newborn care, and then even tracking early signs of poor growth and nutrition. So there are a variety of benefits and impacts that the use of pneumonia-fighting vaccines, for example, PCV, will deliver to individuals, health systems, and governments. But unfortunately, our progress on vaccine access and uptake is lagging. In a previous slide, I showed you that the target for the GAP-D plan really is that we should be having 90% coverage of pneumonia vaccines across the world. For pneumococcal vaccine, which we have mentioned earlier, is one of the most powerful vaccines of those in the pneumonia fighting range, we see that only 48% of children under 5 currently receive pneumonia vaccine, pneumococcal vaccine. This is from the Stop Pneumonia Coalition. Many countries have still not introduced the PCV vaccine. And with the COVID outbreak, unfortunately, even in countries where the PCV vaccine is in use, we've seen data from WHO that shows that there's been backsliding of routine immunization. Below here, you see data from the IA 2030 immunization scorecard that shows that we are actually not on track to meet our targets for DPT3, for PCV3, for MCV2, which contains measles, one of the pneumonia-fighting vaccines, as well. So we were not doing as well as we need to in terms of using the power of vaccines to address pneumonia. Now, in order for us to address the gap in vaccination, we have to think beyond the immunization program. We have to think in an integrated manner. So I highlight here the Child Survival Action Plan, which is a renewed call by stakeholders within the child health space to pick up from where we've stopped to end preventable child deaths. And is in this platform of integrated action that I think we have the best the best chance and option to address the vaccination gap that we are seeing from from the previous data. What we really need to be looking at is integrated services. So where primary health care is placed at the center of a comprehensive response. So immunization is part of it, but at the same time, we have to think about IMCI, we have to think about referral, as Dr. McCullough has said. I'm not going to rehash that again. But the most important thing really is that we know that vaccines are effective. We have the vaccines with us. We have the vaccines, although there are some countries that have not yet introduced the vaccines. But then how do we move forward in taking these interventions that are available in countries, available in the global market, to bring them to all children and all individuals that need them? So it would require a coordinated effort that touches on a number of things that we already have in the system. So this is really about implementation. It's about implementation fidelity, it's about implementation intensity, it's also about galvanizing leadership. So the first thing we really need to do is leadership. Without leadership and without coordination, our efforts will fail. We need to galvanize leaders at the global, regional, country, and sub-national level. Some of the actions that you have shown from CSOs in with the small grants are part of the efforts to tell the leaderships in different countries that pneumonia matters and that the interventions need to be put in place. We need to also build partnerships. So build strong collaborations at the country level. Many times we have a lot of community assets that are not tapped effectively. For example, religious leaders, community leaders can be important advocates, can be important entry points for vaccination, education, even for offering an opportunity for outreach services to happen. Outreach services can happen in churches, in mosques, if we are able to link in with faith-based organizations. So collaboration and looking beyond our usual suspects is very important. The next thing is data and analytics. We cannot address gaps in immunization if we don't know where we are going. Many times the routine immunization data at the country level is of poor quality. You would find coverage rates higher than 100%. But when survey is done, you find that there's a big gap between routine immunization coverage estimated and the survey data. So we need better data and analytics and monitoring frameworks to show us when we are doing well and when we are derailing from our targets. And with COVID, we can see that there is an opportunity to get data real time. So better data systems like immunization registries, birth registries that tell us the children who are born and so we can track them and follow them up is really one of the things that we need to prioritize now and take advantage of from the COVID. We also need stronger advocacy, which is what this community is all about. Advocacy to the political leadership, and also awareness at the grassroots level. And everything depends on resources and financing. Many countries have, support from Gavi, from the Gates Foundation, and other international partners, but there really needs to be an emphasis on national financing, subnational financing for immunization programs, and that the advocacy should really focus not just on awareness, but also on resource mobilization from the countries. I think bringing all these together are really the core things that we need to move the immunization agenda forward to address pneumonia and begin to make more accelerated progress, as we can see that we are stalling and much more needs to be done. So thank you very much for the opportunity to share this.